Hello and welcome back to the Ask Dr. V show, brought to you by Channel of Health, where you can be informed and empowered about health issues that are important to you. I'm the host, Dr. Valda Crowder, but you can call me Dr. V. I've been a board-certified emergency medicine physician now for 30 years, and I have treated patients during 4 pandemics, 1 mass shooting, and a Category 4 hurricane. So rest assured, you are in good hands today. Today we have a really, really big topic because of the government shutdown, and we also have a guest. So today's topic is got insurance, what to know and do when your health insurance is at risk. My guest today is Julie Mitchell. She is the owner and CEO of Curated Insurance, and she will join us later to help you better understand what are your insurance options during the government shutdown, during open enrollment, and beyond. What is actually going to happen with our health insurance premiums as a result of this government shutdown, whether or not it occurs, whether or not the Democrats get their way or the Republicans get their way, like what is actually happening next and what do we need to do? So first, let's look at what's actually at stake and what's going on with health insurance during this government shutdown and before. I want to actually try to really sort of set the table here so we can kind of understand, what is the argument actually about and how does it actually impact us? So in 2016, President Obama and the Democrats passed Obamacare, which is also the Affordable Care Act. And basically, this is a series of government subsidies to make health insurance more affordable for everyone. So since the implementation of Obamacare, 30 million people have become insured with health insurance who previously were uninsured. Now, I always remind people that whether or not someone's insured or not insured, they're still getting sick and they're still going to the emergency department, and they're still, sometimes uninsured people actually have to use the emergency department and very expensive health care more often. So since the passage of Obamacare was passed with 100% Democratic support and no Republican votes on the Senate floor or on the House floor. So since that time, the Republican Party has tried several times, 70 times to be exact, to repeal and replace Obamacare. So that hasn't been successful 70 times. So now the goal is, or now what they're actually fighting over is that part of the big, beautiful bill was to defund Obamacare and dismantle it by actually defunding it. So how would they actually do that? So let me actually talk about how this actually works. So Medicaid, which is set up for people that are right near the poverty level, used to be that you qualified for Medicaid if you were 100% or less of the federal poverty level as far as how much you made. The federal poverty level for 2025 is $15,000 a year for an individual. It's $60,000 a year for a family of 4. So one of the things that Obamacare did was you could qualify for Medicaid if you make up to 138% of the federal poverty level. So what does that look like? So if you're an individual, you make $20,000 or less, or if you're a family of 4, you make $82,000 or less, then you can actually qualify for Medicaid and your health insurance costs nothing. So part of the big, beautiful bill is to actually put in a work requirement on Medicaid that has been used in other states, other southern states, and has kicked about 30% of the people off of Medicaid. Then the second part of Obamacare is the subsidies in the marketplace. So if you make 138 to 400% of the federal poverty level, so that's $60,000 if you're an individual, or $126,000 or less for a family of 4, you could go to the marketplace and you would get a federal subsidy. So here's how the federal subsidy would work. Let's say normally the insurance would be $1,000 a month. You qualify for a $700 a month subsidy. So the federal government pays that $700 to the insurance company, and what you pay is just the $300. So part of what they're fighting over now is they want to phase out or eliminate that subsidy. So that if you're making $100,000 a year, you might have to pay $1,000 or $1,500 a month for health insurance. That is going to price many people out of the marketplace. So it is estimated that roughly about 20 million people will lose health insurance if these changes go forward. And this is the fight that they're actually having now, which has actually led to the shutdown of the federal government. Now, if we keep on going, there's people like myself where I get my insurance through my employer. And there's people who actually make more than 400% of the federal poverty level. We all would be impacted as well, because as soon as you have more people that are uninsured, it drives up the cost of health care for everyone. So our premiums are also being impacted. So I really wanted to talk with someone today that actually really is on the front lines of this insurance debate, and that is Julie Mitchell. I'll bring her in right after news you can use. If you want to learn more, or you've got some questions, maybe you got a letter from your insurance company. All right, what the health is happening? That is the real question, and it is the name of my new podcast where you can literally get life-changing advice. Every Thursday, we upload new episodes to What the Health is Happening, and you get the inside scoop on all types of health matters so that you can be informed and empowered about your health. What the Health is Happening is your dose of medical reality with me and my friends that I interview that are from the front lines of healthcare. Download, subscribe, and comment. Tell us what you actually, what you need and what you want to talk about. So here to help us unpack what is happening with health insurance, open enrollment, and the government shutdown is our guest today, Julie Mitchell, owner and CEO of Curated Insurance. Julie actually services clients across the United States and the District of Columbia. Julie, thanks for joining me today. With everything
going, how are you?
I'm doing great. I'm doing very good. With everything that's going on today, with the government shutdown and health insurance, your phone should be ringing off the hook. Is that what's happening?
It is for certain. Yes, indeed.
So tell me, Julie, what are people actually, what are people calling and what are people actually concerned about?
Thank you for asking. Let me start off by saying, Dr. V, the information you bring to people, it's life-changing. And I love that you are improving people's lives, and I thank you for supporting a healthy and productive society. That is part of my core mission. So I definitely love that I'm on the show with you and all the work that you've done.
Thank you.
Yeah, you're welcome.
So what are people calling you about?
People are calling me about their doctors. Right now, doctors are a challenge. People do want to keep their doctors. They're also calling me about their changes that they're seeing in their notices from the insurance companies. So those of you who have insurance, whether it's Medicare or it's an under 65 plan, you've noticed some changes in all different aspects of your plan where the premiums are going up. Likely your copays are going up, your maximum out-of-pocket, your deductible. So all of those things are going up, and at the bottom line, there's a lot of anxiety.
Right.
What I want everybody to know is that there are choices, right? So I have avoid15.com.
Okay.
You can go there. It'll have a summary of some things you can do so that you can avoid the high cost, and you can make sure you've got the right adjustments that you need to make.
Right. So now tell me, so the insurance companies, are they sending out letters? Who's getting these letters? Because one of my girlfriends called me and said that she got a letter. I haven't gotten a letter. I get my insurance through my employer. Who is getting these letters, and what are these letters saying?
So it would be individual. People get individual insurance. An entrepreneur, somebody for whatever reasons doesn't have employer insurance, and for Medicare, it's your annual notice of change. Right, you're getting those letters this month, so that you can compare what you have, what you normally have, to what will happen for you in 2026.
Okay, and would you say that the folks that are calling you, is everyone getting letters that there's an increase? Do you feel like everyone's getting an increase? Everyone will get an increase.
And the reasons behind that are in four buckets: the insurance companies, adjustments, as you mentioned, the Biden extension falling off, and with the big beautiful bill, the changes there with Medicaid, as well as the Centers for Medicare and Medicaid have made some changes as well. So one of the things people are going to see is if you're used to a $0 plan, that's no longer going to exist. Plans will be at least $5, so your premiums will go up at least $5. Right. However, the high end is $1,500 each month. The premiums will rise for some people as high as $1,500 each month.
Okay. Yeah. Now,
that's why I want to make sure people go to avoid15.com to see where they fall,
right?
And it kind of helps get some clarity on the situation.
Now, do you find, is there any real difference by state or by county, or does it not really matter? It doesn't really matter where you live?
It doesn't matter where you live as far as like whether or not your premiums will rise. The amount you rise does depend on the state. Some states will kick in a little extra subsidy to help cover the spread. Mm-hmm. So those states won't see as high of an increase. It's gonna. I mean, you're everybody. So here's the thing: everybody's different.
Right.
Whether you're looking to have individual insurance because you've lost your job, or you have individual insurance because you're an entrepreneur, or you're the spouse of someone and the compensation at work isn't enough,
right?
That is going to go ahead and cover you.
Okay.
One thing that is still intact with the Affordable Care Act is that your premiums need to be 10% or less of your income, right?
Okay.
So for the people that are between 138 and 400% above the federal poverty level, you're still going to have a tax credit that will help you afford your tax bill, your monthly premium. Where the cliff comes in, that you've got two things. Your insurance has risen, and you're not going to be covered by the subsidy. So that's why that extra, and it's an extra $1,500. So let's say you're used to paying, $1,000 a month for your bill for your family,
right? And
then it'll rise an extra $1,500, so you'll get $2,500 a month.
Wow. So let me ask you this: when you said that the tax credit will remain, so basically I still have to put out the additional cash for 12 months, and then I don't get the rebate or the tax credit till the end of the year, correct?
So the beauty of the Affordable Care Act is that it's an advanced tax credit.
Okay.
So the subsidy is what the subsidy is. It's an advanced tax credit. So instead of waiting until tax time to get the money reimbursed, it gives it to you real time. So each month they apply a tax credit. Another piece of the big beautiful bill that people need to make sure that they're thinking of this season is you've got to reconcile your taxes. That's going to matter more than it has in the past. Mm-hmm. Because if you haven't filed taxes and you haven't reconciled, then that subsidy will not be there for you, right? Which means you filed your taxes, you did your forms, so that if the tax credit was too high or too low, right, you've paid the difference. Okay, so let me ask you this. So Medicare, which really impacts those that are 65 and older, a lot of elderly people are looking at Medicare Advantage. Can you kind of explain a little bit about what is Medicare Advantage, and how would Medicare Advantage be impacted by this? Certainly. Let me bring it up a little bit higher. So Medicare, just to be, because Medicare and Medicaid often get confused. Medicare is for people that are 65 and older, mm-hmm, and it's also for people that have a disability like end-stage renal disease. So Medicare can be for all ages. It's mostly for people that are 65 and older. And if they are coupled with having Medicaid because they're low income, then that's the population that's mostly impacted, because generally they don't have what they need to meet the work requirements.
Right.
So they're looking at, how do we do some form of supplement? There is the Medicare Advantage plan, which takes over your Medicare, and it can be the best bet for somebody because you don't have underwriting and the premiums are pretty low. Now, they do have other parts with it. So sometimes the better bet is to do the Medicare supplement, one of those plans, but you do have to go through underwriting, and they do have a higher monthly premium.
Okay.
So the big thing for people to know on the show right now is to go to avoid15.com, because you put in your situation and we can see, where do you fall? So take good care of yourself and take good care of your health care,
Right. So I'm just kind of curious. I mean, do you think that any of this will, we're in this government shutdown now because they're arguing about this, right? So
rightfully so.
Yeah, and do you think that, like, if we're able to actually get these subsidies back, will the premiums go lower? Like, what's going to actually? It seems to me like, and this is just how I'm looking at it, it seems to me like the insurance companies are assuming the worst. Is that what's happening? Because people are getting letters with, like, almost 50-100% increase in their health care premiums, which is why I decided to do this show today. So are health insurance companies assuming the worst, in that they're assuming that the big beautiful bill is going to go into effect and all of this stuff is going to happen? Is that what's happening, or do we have
the assumption is that the big beautiful bill will go into effect, that the subsidies will not be extended, and the biggest reason why we have to assume that, right? Okay. In order to prepare for 2026, and in talking about these different things, at the core of what I'm experiencing with people is high anxiety, right?
Yes.
What is more important now than ever is that you find a good agent, because what we do is we bring a strategy around that fear and anxiety that you may be feeling.
Right.
What we'll find out is, what is your situation? Where are you? And how can we tailor a plan that fits your needs, more importantly, your budget, right?
Right.
And that's why I did the website for the show, avoid15.com.
Right. And what is 15? What is 15 is standing for what?
The 1.5K, avoid15K.com.
Okay.
It's avoiding that 1,500 increase that is possible.
That is possible. I got you. Okay. Yeah. So now, what about Obamacare? Are you seeing that is still a good option? Because I'm seeing, even for Obamacare, premiums are $1,000 or so. Does it matter if you're married or have a family? Like, what sort of things actually make a difference?
Obamacare is it's brilliant. I mean, it came from the Heritage Foundation, and Obama adopted it, and the core of what it was resolving is, as you said earlier in the show, we as taxpayers pay for emergency room visits by those people who don't have the money to take care of themselves in other ways.
Right.
And what was figured out is it's less expensive for taxpayers to subsidize a plan that gives you preventative care, right?
Right.
That gives you doctor visits, so we can reduce the cost of an emergency room.
Right. And a lot of people don't realize that we are federally mandated through EMTALA in the emergency department to actually take care of and deal with all emergency complaints, no matter whether or not you have insurance or not, right? So the emergency department, which is where I work, is really the safety net of the healthcare system. And when people are insured and they cannot get in to see their doctor, and sometimes it's people who even are insured and still can't get in to see their doctors, because trying to get an appointment to see your doctor sometimes can be kind of difficult. You know what I mean? I mean, I got a letter. I got a letter just 2 weeks ago that my doctor had quit. I said, "Oh my gosh, I got to find a new doctor." So
same here, and that's devastating when you find out your doctor's taking a break or quit.
Yeah,
it's like, what am I supposed to do? I'm like, I have medication I need to get filled.
Yeah, I've got to go back to the catalog and figure out who I like, and then try to see if they're accepting new patients, and then make an appointment. And here's the thing: is I always tell people, and I'm healthy and well. Right? What if I was doing this and I'm not healthy and well? So, Julie, why I have you, I want to actually talk a little bit about Medicaid. Because one of the things that I actually didn't realize was 41% of the children born in America are born and their deliveries are paid for by Medicaid. So, tell me what's actually, we may have listeners who might be pregnant or in the middle of a pregnancy. How does Medicaid work and provide insurance for those that are pregnant?
So Medicaid, it depends on your state. So some states are better about Medicaid. Some states are not so good about Medicaid. When it comes to pregnancies, it's a universal desire in our society to make sure that pregnant women and children are taken care of. So in that realm for Medicaid, you're going to be okay.
Okay.
And for the most part, listeners who may feel some anxiety over this, take a deep breath. We've got you taken care of. There is a plan that we can do. We can help you, whatever your situation is. You're going to need an agent more this time than ever, and get that clarity so that you can put a strategy behind that fear.
So, and then lastly, here in Washington, D.C., we have a lot of people who have separated from their jobs, particularly government employees. And some of them are actually having to use COBRA for their insurance. Are we seeing the same increases in COBRA rates? Or if you separated from your job and you were given a COBRA rate for a year or 2 years, I don't know exactly how it works, do they have to honor that? Given that we have so many people separating from their job, do you know what's happening in that area of the marketplace?
Yes, with COBRA, you're going to have, COBRA is the same benefit that you had through your work, and your employer's no longer chipping in. So the big surprise there, without any increases in the insurance, is that you're now not getting that employer contribution, and I've saved people $300 to $800 monthly just from COBRA to a different type of plan, right? So those aren't necessarily going to increase as much. It'll be the same as what your employer insurance was before. It's just you don't have the employer contribution.
Okay.
And for those people who are leaving or losing, somehow changing their employment, reach out to an agent. And there's some really great resources for not only the Affordable Care Act, but also alternative plans, because there's some alternative plans, and you have to be careful because some of the plans are not good plans, and some of the plans don't have great publicity, right? They're good plans for someone, but they're just not good plans for everyone, right?
Okay.
And having a professional help you navigate this landscape, because my goodness, I am educated, I promise you. It took me a good 6 months before I could wrap my head around what the insurance companies were doing and why they were doing it. And this was before all the changes with the government, right?
Right, exactly. Yes, exactly. So, Julie, are there any things that you think people should be asking or should be trying to figure out during this time period?
start with your doctors. Find out what networks your doctors are going to be in, your income and your budget. This time, your income is going to matter more than anything, to the penny. Give the best projection you can, right? And seek a professional on this. I can't say it enough because the people that I help at the end of like trying to figure things out, they're frazzled, blah, blah, blah. And they're like, I made that so easy. I made it easy because I do it a lot, but right. I can't imagine being on the other side and just coming into it without professional help. So yeah, avoid 15k.com and make sure that you're not one of those that has that up to 1,500
right
increase.
So, Julie, if any of the listeners have more questions or they want to get in contact with you, you do provide insurance brokerage help in all 50 states?
Correct.
All right, and how would
all
they?
50 states and DC.
All right, wonderful. And how would they get in contact with you or email, either an email or a phone number?
Yeah, my phone number is 214-831-7037.
All right, I want to thank you. That's my last question for today. I love answering your questions and empowering you and your family with health information that can improve your overall health. Be sure to keep sending your questions in. You can email me at info@askdrv.us. That's info@askdrv.us.